Hi, today I am so delighted in meeting you the program JIP's 3 p.m. 3-point medics. So, we have been learning about prothrombin time. Now it's a high time to switch over to learn its twin brother APTT. What do you mean by APTT? Activated partial thromboplastin time. The name implies partial. Why it refers to partial? The partial refers to there is partial content is getting added to or added during the preparation of APTT. During the preparation of prothrombin time, we are adding tissue factor and phospholipid and calcium, collectively called thromboplastin. Adding tissue factor is to stimulate the extrinsic pathway that is meant for preparation of prothrombin time. Here we are doing APTT. So this tissue factor is not at all needed. So we add only calcium and phospholipid. So it is a partial mixture. We are excluding tissue factor. That's why it is called partial thromboplastin time. Why it is called activated? Yes, to enhance the coagulation process, we add one more substance that is called activator. That's why it is called activated partial thromboplastin time. Point number 1, where it plays a major role. As I told you earlier, prothrombin time meant for assessing the extrinsic pathway, or otherwise literally it simply assesses the factor 7. Suppose if there is factor 7 deficiency, your prothrombin time will be alone prolonged. Okay. But APTT assesses all the clotting factors other than factor 7. Suppose APTT is prolonged means other than factor 7, some form of clotting factors deficiency exists. So, if somebody has normal prothrombin time, that means factor 7 deficiency is ruled out. But APTT prolonged means, so the rest of the clotting factors, one of the rest of the clotting factors have been prolonged. So this is the main motive of doing PT and APTT in assessing the clotting factor deficiency. Otherwise, in most of the cases, wherever PT is prolonged, APTT also prolonged. Wherever APTT is prolonged, PT also prolonged. The common causes include chronic liver disease. Yes, in mild liver disease, PT may be elevated. But in severe liver disease, all the clotting factors will be compromised. So both PT and APTT will be prolonged. In vitamin K deficiency, yes, PT and APTT all will be prolonged at some point of time. Antiphospholipid antibody syndrome, yes, all PT and APTT will be prolonged. In disseminated intravascular coagulation, yes, PT and APTT will be prolonged. So only few causes, PT may be normal, APTT may be prolonged. APTT may be normal or PT may be prolonged. If PT is prolonged and APTT is normal, then you have to think of factor 7 deficiency. And one more cause where PT alone will be prolonged is warfarin. And APTT prolonged, then PT normal means factor 7 deficiency ruled out. So rest of the clotting factor deficiency, one of the rest of the clotting factor deficiency should be thought of. And when you give heparin infusion, unfractionated heparin infusion, where APTT will be alone prolonged and PT will be normal. So these are the scenarios you have to keep in mind during the interpretation of PT and APTT prolongation. Thank you.